But first, to warmly welcome you together with Charlotte. Charlotte, how are you doing?
I'm doing great, and warm welcome, everyone. As always, it's a pleasure to connect with you, our guests of honor and pilot survey contributors.
All right, thanks, Charlotte. And so, what are we talking about when we talk about Teach to Reach? We are in a hurry today. If somebody is ready to answer that question, this is a question we very often ask in the beginning of the session, but I thought it'd be nice to hear how Charlotte defines Teach to Reach in one sentence. What is it that brings us together today?
Teach to Reach is an opportunity to meet, to connect, and learn from one another around various topics that affect our day-to-day health lives.
All right, wonderful. Then, well, those of you who are watching, perhaps for the very first time, if you have poor connectivity, you can go to www.learningfoundation.com/podcast, and you can we also encourage you to follow us on social media. In fact, one of the reasons we're coming together here with our guests of honor, with the pilot survey participants, is to make sure we're going to amplify the topic of the discussion today. So, we're here because we're collaborating with Grand Challenges Canada, and very happy to hear that, to see that Joanna Sanchez is joining us from Canada. So early morning from her. For her, Joanna, would you like to say good morning?
Yes, good morning, good afternoon, good evening from wherever you are in the world. So great to see everyone.
All right, great. And so we wanted to actually start with a quick update from you, from Grand Challenges Canada. For those of you who may not be familiar or who were not their previous sessions, just to briefly introduce yourself, and then to tell us where is Grand Challenges Canada on the timeline towards launching a new Grand Challenge.
Hi again. Yeah, so this is going to be a very exciting year for us because we're starting the year with essentially this survey that we've launched together with the Geneva Learning Foundation. And this is the first of many steps towards launching a global RFP, or call for proposals, for a new climate and health funding program that Grand Challenges Canada is going to lead in partnerships with a lot of other major global funders. And so the survey that was launched actually last month on January 15th will guide us. We are here to learn, listen, and take inputs from the local communities to guide the direction, which is essentially something we've never done quite like this before. We are very eager to, in the climate and health space, to really take the experiences of those at the front lines of this climate and health crisis, and use that to guide as we develop this new funding program. And so that is expected to launch between January and March of 2026. And then the results of the survey, which will be ready hopefully to present publicly to the world and to all participants and respondents between September and October of this year of 2025.
Thank you very much indeed, Joanna. I just want to share a few of the messages if you'd like to. Whoops, this is actually the French version. Sorry about that. If you'd like to request to speak, type your message in the chat, raise your hand, check your microphone and headset, and then we'll call on you so you can unmute your microphone. We do want just to greet a few of you. So, Bolatito Adeonojobi, thank you for your greeting. You're joining from Ogun State, Nigeria. Tafurodo Mutange, welcome back, I should say. And then Becky Tagbo actually answered our question. Which we ask nearly every time. What's Teach to Reach? A great time for strategic exchanges to impact lives globally. Mario says, I think Teach to Reach is turning into something more, a network of proactive professionals looking to take care of the world. And so this is our first question for you. You know that with Grand Challenges Canada, as well as a real network of dissemination partners and the organization Science for Africa, the Global Grand Challenges Network, we launched this new global survey seeking insights on climate and health from the health community, broadly defined, but with a focus on people who are really at the local and community level. and then as well as humanitarian workers. So our first question is very simple, and we'll see who can be the quickest to raise their hand to answer yes or no. Have you actually completed the survey? And if you haven't, then we'll ask you why. If you have, you will ask you what surprised you about it. Okay, I see Usman Mohammed Tukur is first one up. So please, Mohammed, a warm welcome to you, and tell us, have you completed this climate and health survey?
Thank you so much, Reda, for giving me this kind of opportunity. First of all, my name is Usman Muhammad Tukur from Kano State, Nigeria. Actually, yes, I completed the survey, and what actually surprised me is that how now attention turned to issue of climate change and health, which is initially or previously there is not much attention in this kind of area. So that really surprised me. Now there is a huge work for us to do in that climate change and health. People are underrating it, but it's very, very vital and significant in our life and our people in the community. So I really surprised this kind of attention, this kind of organization for global impact in the kind of climate change and health. So thank you so much for giving me this opportunity, Reda. Nice to meet every one of you.
Thank you very much indeed, Usman Mohammed. I see, okay, there's several more hands raised. It'd be great to hear from someone who hasn't yet completed this survey. But let's go to Bolatito Adeonojobi. A warm welcome to you. Don't forget to introduce yourself and tell us, did you complete the survey? If yes, what surprised you? If not, why haven't you done it yet?
Oh, good afternoon. The climate change and health, I think, is very relevant because it's affecting the whole world. Turning around, so many things are getting dried up. Where there's excess flood, nothing is going well. The animals are dying. People are being sick because of the heat. So it's affecting health in various ways, both on nutrition and the health itself. A lot of cough, flu, everywhere, where there's tiredness, where there's... In fact, I think we need to do more on climate change, and I want to really thank Reda because it's a very great thing that you are doing for us, and it's an opportunity to go to the grassroots to see more about what is going on there. I think I love the program and the event because we are closer to the grassroots now. And we could see what was going on in there. It's affecting health, it's affecting farming, it's affecting so many things. It's not even one, it's so many things. So I think we are doing a very good work. Thank you very much.
Thank you.
And I'm happy to be part of it.
Thank you very much indeed. The team at the Geneva Learning Foundation, we always appreciate praise, but we also look for your critical insights into how we can improve. I see Nagudi Mwajuma said, I haven't taken the survey, or so type no into the chat. So Nagudi, would be lovely to hear from you. Tell us, maybe you missed it in December, you were too busy. There could be any of a number of reasons, but we'd love to hear what are the barriers. That's kind of a Grand Challenges Canada way of thinking. What are the barriers to your participation? Let me see if there are any other no's. All right. So as I said, this is intended to be a very practical session and focused on today's call to action. So you receive this email and really it's your invitation to participate, to respond to this call to action. So first of all, it's if you are affiliated with an organization that you are authorized to represent. We'll come back to that specific point. Your organization can now become a partner of this global climate and health survey. Second, the call to action is to really begin to share the survey with your networks on WhatsApp, Telegram, LinkedIn, Facebook, Instagram, X, Twitter, email, whatever means you have available. And really important to tell us who you shared with. So if you have any questions about that now, please raise your hand or type your messages in the chat. Let's just lower all the hands so we don't so we know what everyone is responding to. And what we're going to do in today's session, we're hoping to keep it down to 30 minutes plus however long it takes to listen to you, because that is actually the most important point of this session. First of all, to just recall what this is about. And so here we do want to share the links now to, first of all, the Lancet commentary. So you'll see there's actually Grand Challenges Canada issued a press release to announce this, just that. Okay, and it's a very long bibliographic reference. Maybe we could ask Joanna, why are there so many people who co-signed this commentary in the Lancet Global Health, and why does this matter from your perspective at Grand Challenges Canada? That this survey is mentioned and commented on in this medical journal.
Sure. So with respect to the journal publication itself, we have convened an expert panel that is going to be reviewing the results of the survey and guiding Grand Challenges Canada as well as all our disseminating partners in terms of determining what are the priorities. Should we look at this in a geographic approach and perhaps, focus in on regions if we're seeing great variability around the world? And so we published this in an academic journal along with our expert panel, both to announce the expert panel, because if you read the article, you will see, in fact, Charlotte has put it in the chat, and you can see all the co-authors, which essentially represent the expert panels from all around the world. We're representing every region, every continent. And they're all experts in health, climate, or climate and health. And essentially, we want to show that we are working together to review this in a scientifically rigorous manner as well. And then the press release that I think that Retta was also alluding to also shows a large list of global disseminating partners, which we're inviting you to be a part of. And the reason for that list as well is because initially this started as an partnership between Grand Challenges Canada and the Geneva Learning Foundation through Teach to Reach, and it's quickly become bigger and bigger. More people are saying, we want to know these answers too. We want to listen. We love the grassroots approach. And so you'll notice that there are names of multilateral organizations, NGOs, other funders, big funders around the world who are joining us in sharing this with their networks as well. Because we're going to make this publicly available to the world so that everybody can use for research purposes, for clinical purposes, for funding purposes, policy. And so we are very much about collaboration, partnership, working together as a world on a very much a global crisis.
Thank you, Joanna. Now, here is how you become an organizational partner, and this is the first thing we want to cover. So this requires you to find the personalized link that was included in the email that you received as invitation to this meeting. So you need to find that, locate that first. And then the first thing, and sometimes we get applications to for an organization to become partner, and we realize that the person doesn't have the level of seniority, is not a decision maker, and has really not been authorized. So they really would like to participate, but unfortunately this requires you to be able in a position to commit your organization. So while we appreciate that you can remain committed and engaged and participate and contribute as an individual, but if you do not have your organization's backing, please do not apply on behalf of your organization. So you need to find your personalized link and then submit your organization's application. Just to show you what that looks like in practice, we can have a look here. So if you speak French, this is not relevant for this meeting. There's a translation button, so you can safely ignore this here. Now this refers this as a partner for okay, and actually this is the French version, but I think this should be fine. So you go through this, you see if you want to receive other invitations and opportunities. If you are a Teach to Reach partner, you or someone else from your organization has already gone through this. So if I was applying for the Geneva Learning Foundation, I would go through this. It shouldn't take, there may be 10, 12 questions. So the idea is that a busy organizational leader or another representative that is empowered to represent the organization can quickly complete this. And then to be crystal clear on the partner selection criteria. So first of all, your application needs to be complete. Second, as I said, you need to be an authorized representative. There will be, we've communicated the deadline, and then there is a review and approval process by the Geneva Learning Foundation. And then the final criteria that you see on this list is what we call proof of dissemination. And that is actually a critical part of your application, even though it's not done in the application, and we're actually inviting everyone to do it. So here, again, we're going to mark a pause, and I see there's already some great contributions. So let me see if I can pull some of them on screen. We're going to do another call for with a different question for organizational partners. Will your organization become a survey partner? Why or why not? So let's see, we have, we'd love to hear, for example, from Lindo Kule Sibia, who said, who's greeting us from Eswatini and who's a founder of an organization called Youth and Women for Change in Eswatini. Mario Chadzida Mianos says we'll be joining as partners, so it'd be great to hear from him as well. Faiza Rabani has a more general comment about how, in her view, from Pakistan, TGLF has cultivated a universal team of healthcare providers with a global vision. Thank you, Faiza. Marian Mutange from Mountain View like-minded community. Tell us if would be great to hear from you as well. Tell us why or why not you'd be joining. You'd like to be a partner in this survey. Tijani Suleiman, you just said hello, but the same question. And then Dr. Tusime Ramadan, who leads a remarkable volunteer-led organization in Port Fordal, Uganda. Would be great to hear from you as well. Charlotte, who shall we hear from?
Right now, we are going to hear from Mario. Mario has a mic unmuted, and then immediately afterward, we also have Lindo Kule, who has also unmuted themselves. So Mario, we'll start with you.
Hello, everyone, and thank you for having me. Thank you for another excellent meeting organized by the Geneva Learning Foundation and the Grand Challenges Canada. The reason why we want to become partners is because, as I wrote to my comments, there are a lot of commodities in between what low-income countries are facing with climate change. The same applies with the Balkans, and we are strategically developing a dissemination project for these findings that will go throughout this summer in meetings to take place in Greece with specialists and professionals from the Balkan region and from the European Union who would like to associate themselves into this initiative of taking care of the world before it's too late. Thank you.
Thank you very much, Mario. Charlotte? Yep.
Lidokule Sibia, over to you.
Compliments to everyone. It's afternoon in Eswatini. For the sake of pronunciation, please use Linda.
Linda.
Okay, basically, yes, you're welcome. Basically, my reason for being here and collaborating is my personal lived experience and the gap that I see between people understanding on and a few communities where people are more is why are they not receiving enough farm products like they used to. Another issue it would be, as I work in these communities, I see that people
I'm afraid I don't know about you, Charlotte, but I'm having trouble following Linda's voice, unfortunately.
So I want to begin collaborating and networking in this community. Thank you very much.
Thank you very much indeed.
Yeah, thank you for that.
Sorry.
All right. Is there someone else, Charlotte, that we're going to hear from?
I'd invited Marion to unmute, but she's added another comment in the chat, so maybe she's not in a position to speak here now.
Okay, so Marion says, my organization will be a survey partner because we want to learn from peer learning and networking with colleagues from all over the world to come and implement in my community. We also have Ali Wiyatu, who said that I have filled out the survey. I have an interest in climate change. Ali Wiyatu, if you could tell us if you are affiliated with an organization. And so the current question on screen is, will your organization become a survey partner? Why or why not? And the same question to Taban Anthony Stephen. Tell us what organization you're affiliated with, and do raise your hand if you'd like to share. I see Alawiyatu.
Yeah.
Hello. Yeah, my organization, Nan Women and Youth Development Foundation, have interest. We have interest in the survey. We want to be a survey partner. And the reason is because this climate change really affects our communities. As I have said, we have a lot of rivers and streams, and it's a barrier to our health professionals in crossing those streams and rivers to reach out settlements to deliver vaccine or other medications in such areas. And again, we need to have or to make ourselves prepared for such a kind of disaster like the floods. Maybe if we have the knowledge on how to tackle such this thing, we can be able to get ourselves prepared within such communities, so that both the transportations of immunization, vaccines, medications, even the health professionals, we can be fully prepared so that we can prevent the risks and then the barriers to reach such places. Thank you, and over.
Thank you very much indeed. And for those of you who have not been involved with the survey development process, maybe you were not there at Teach to Reach 11 and you're now watching this online, this survey is about three main topics. First of all, we want to try to understand together as a health community what climate changes you see in your community, how these changes are affecting people's health, and what makes it difficult to protect people's health. What are the barriers that you see? And your perspective, especially for TGLF, if you are a health worker at the local level, you know that we especially we believe that there's a special value to why your answers matter and your responses. One thing is that they're going to help Grand Challenges Canada and all the other partners involved to create new funding for local solutions. That's more important than ever. They want to know what support communities need most. And we're reaching out to you, trusting you to be able to help us with bringing home meaningful answers that we'll share back with you and share with the global community. And you can see some of the questions here. If you've participated in sessions before, if you've already taken the survey, you've seen these questions. What we're trying to get at is what you are seeing and what is changing. And especially around the barriers to health action, including the barriers to at the local and community levels and with the communities themselves. So I say all this just to recall why we're working with Grand Challenges Canada on this survey. And we're now going to go into our favorite part of these consultations, and that's the practical exercise. We're going to share the links. So let me see. We have here just posted into the chat. So this is for people in our Zoom studio. You'll find the links if you're watching. If you watch this later on YouTube, you should find the links as part of the YouTube description or on any of the Geneva Learning Foundation's social media. So let's see how this actually works in practice. Many of you are going to be sharing on WhatsApp, and I know you're sitting in front of your maybe your phone or your tablet or your computer. This is something that you can do right now, and then we'll discuss it once we have actually done it. So first thing is, if you click on the first, and most of you use WhatsApp, we know we'll see like 3 likes on Facebook and 1,000 shares on WhatsApp. So let's try the short link for WhatsApp. So when you actually click on it, and you should be able to do that and stay in Zoom without losing your Zoom connection. So you'll see it'll open up your browser, and you can see that here there's a short text, and as soon as you continue to chat, it'll open up your WhatsApp, and then you'll be able to share with all of the groups, channels, colleagues, friends, families, family members that you are a part of. And so this really, in a few clicks, you can actually help amplify this global survey. So I'd like you to type yes into the chat as soon as you have done so. So you've actually clicked on the WhatsApp link, and I'm sure it's going to disappear if there are. Okay. And Dr. Tsusimi Ramadan, thank you for typing yes to confirm that your organization will become a survey partner. Shanta Gatak, thank you for sharing via WhatsApp. Let's keep going. Kingsley Niniere, right now only a few of you have told us about this, about sharing. Aminu Umar, so it looks like right now only 3, 5, 6, 7, 8 of you. Okay, 9 have actually shared. So please, you can say yes, you can confirm that your organization will be participating, but already as an individual, you can go to WhatsApp and share with your colleagues, with the groups that you're part of. They can be on health, they can be on other topics, but we need to get we want to get the word out, and we can do this as a community and with you and with the Teach to Reach community. So that is the first one. Let me go back to the call to action, and this time going to look at some of the other options. So again, if we go here, for anybody who uses X, that used to be Twitter, here we get into the specifics of how when you click on the link, you'll see that you don't have to type or think about it. You get a message that's ready to go and that you can post right away. But I'll show you what else you can do here. Is once you have done that, then you will repost and comment. So that is for anybody who is on X and Twitter. So just type yes if you are on X and Twitter. I'm going to share the next link, which is LinkedIn. Now, LinkedIn is especially important. It's a professional network. If you're not on LinkedIn yet, I encourage you to create your account now, share on LinkedIn. And so you can see here, this will take you again to the page. So here, there's a little bit more work involved in terms of sharing on LinkedIn. But you'll see there are really 3 things that we're asking you to do. The first one, the most important, is actually to repost. So you go here and you click on repost. Now you do have some options. You can share with your thoughts. If you have time, that's a great thing to do. So your colleagues can see that you're not just randomly just clicking on the button, but you're actually giving it some thought. So in my case, I'm just doing a demo. So I'm just going to click on repost. And again, if you're short on time, what repost will do, this is really powerful because this is actually how you can ensure that your colleagues will see that this is something you value, something that's important, and that matters to you. The second thing is like. And so here you just click on the like button, and all of these platforms have some sort of like button. The last one takes a little bit more effort, requires you to actually compose a message, so you can comment. I encourage everyone to take this survey. And then what you can do, something that can actually make a big difference, is if you type the symbol @ just like in an email address, and then I'm going to look for Joanna. You can type, whoops, if I can, yeah, here. And I see Joanna Sanchez, who's with us here from our esteemed partner, Grand Challenges Canada. Well, I really want her to see this message about the survey, so I'll add her to my comment, and that means she will get a notification showing that, yes, I'm asking her to just have a look at this particular post. And of course, the post includes all of the information you need to actually, for your colleagues to get to the survey. So that is for LinkedIn. If you are on Facebook, all right, and okay, and wonderful. I'm going to share some of the messages from those of you who told us who you shared with. It's important not just to sort of blindly, hit everyone with your messages. It's important to take the time to think through, if you can add a personal message, it shows, there's so much spam, there's so much sort of useless information. This one is important. This one matters for health. So if you can take a minute just to think through who you're going to share this with. Don't share with sort of random people. I don't think that's useful. And of course, this is as an individual. For those of you who become organizational partners, we'll be asking you to go a step further. The same thing with Facebook. And so here again, we're sharing the direct link. And right now you can see there's 2 likes, 1 comment, and 5 shares. Okay, so if Taban Anthony, I know, is in the room, Zakir Mahesh is also with us, Charles Adeyemo. So thank you for sharing. Again, we're going to ask here. We're actually going to go back to the LinkedIn post just to see how that's going. And then there's also Instagram as an option. But so I'm just going to share again all of the all of the links, and those are also in the email that you received for the invitation to this session. You can see here. You can see that point 2 is the call to action to share the survey with your networks on WhatsApp, Telegram, LinkedIn, Facebook, Instagram, and X, Twitter. So this leads us to our next and final question for this session. We're at the 29-minute mark, so we're a little bit behind the time. We'll go back and check on LinkedIn, Facebook, and X to see how many people have actually shared. But again, this is a practical activity. What we'd like to do now, we're going to lower all the hands because we have a new set of questions. Who will you invite to take the survey? And what concrete steps will you take to ensure effective dissemination? So this is both for individuals and if you'd like to speak to how your organization is going to share the survey. So we're going to open up and over to Charlotte to lead us.
Here, that's why I see. And I'm encouraging, if you haven't spoken before, please go ahead and raise your hand. We have Usman Mohamed Tuku, who was the first to raise his hand now. And then I'll be encouraging others too. Go ahead. Okay, Usman, over to you.
Thank you so much, Charlotte, for giving me this opportunity to say something about who will I invite to take survey. Actually, the survey is very important. So many people have input to put in this survey, whether they are working in health professional, whether they are working in government sector, state level, national level, and other things. Even those who are studying, university students are very critical for them to attend this kind of survey because it is very, very important because climate change is everywhere. It can be at the community level, state level, national level, country level, and even globally. So everybody has something to say about the survey, has information to input in the survey that can help to develop a very, very strategic point at the end of the day. So that I will invite many, many people to attend the survey.
Okay. Usman, can we get specific with who you're going to invite? Are you going to invite your colleagues? If so, how many? Who are they? Why do you think that their perspective matters to help us understand the climate and health? But who are you actually going to share? Or maybe you've already shared. Can you tell us who they are?
Yes. Okay. I already shared in my link and other WhatsApp social medias. But particularly now, I'm going to share or invite my colleagues that are working in health sector and some professional that are related to either they are working in organization, NGOs and CBOs and other things. That is the first category. Then the second category is I'm going to invite academicians who are my colleagues. Those are who are lecturing at the tertiary institution, especially health institution, so that they can educate their students to participate in this kind of survey because their students, they know a lot of climate change issue, particularly to the health sector. I will invite such kind of category, especially those who are, let's say, particularly studying this issue of geography as a course. Definitely they have something to say about the climate change issue related to the health issue because they know how the variation of climate, what the effect is normally affecting to the community. So these are the two kind of category people I'm going to invite. Those who are working in the health sector and those who are working in academician, that is the academic line, so that they can educate their students to also participate in the survey because it will really make an input. Their input, it will be a significance to the survey.
Thank you, Usman Mohamed Tukur. Just to tell you a little bit more about one of the things, as you know, we've invited today. You were amongst our guests of honors. Many of you participated in the survey pilot. One of the ways in which we honor you after Teach to Reach is you'll see an example here on screen. We've just launched a series about what prevents health workers from reaching communities when weather disrupts care. And so here, for example, we have Al Hassan Kenneth Mohammed. I don't know if he's in the room with us now, but he was at Teach to Reach, and he told us about how it's very difficult for people to seek care for their health needs. So you'll be seeing this series. So once you have shared the initial call for the survey, this is a great way to honor, recognize, support colleagues, and help spread the word. I'm going to share just the link to this post so we can see if there are if we can, if this group can also amplify this Teach to Reach guest of honor, Al Hassan Kenneth Mohammed's testimonial, and we have a number of others coming up. Charlotte, back to you.
Thanks, Reda. So many raised hands. Gifty Akosua, over to you. Who are you going to share the survey with, and how are you going to do that?
Yeah, hello everyone. Good afternoon, good evening from where we're speaking from. It's always a privilege to speak on this platform. I'm honored. Okay, so with the dissemination, I will want to share with my new digital director because he's new one to public health because he's in the public health field. So this is an eye opener for him because he's ready to pick up as in all activities that is being done under public health. So I'll share with him. Then I also share with my colleagues from the university because since we are all public health nurses and we are having a top-up program, it will also be an added advantage for them to also learn from there. Then to my colleagues at work, I'll focus on the disease control officers because anytime I have my sessions on the platform on the Geneva Learning Foundation, I try to inform them where we can just put our heads together to make changes or to adapt to the new things that I've learned from Geneva. So still I'll share with them also. And then also health promotion officers because they also help us when we are going for our advocacy programs in the community, we go with them. So they still have to hear. Then the last people will be my own people, that is the Mandela Washington Fellowship. You know, we are young leaders that are causing change in the community. So these are also another opportunity for them to learn and to relay. And so I'll share with them as well. So I'll do that through the LinkedIn because I think usually page or platform has become a bit more professional where we don't have people maybe to say, I don't want to use the word misbehaving, but like it's more professional. So I'll share through the LinkedIn and also through the WhatsApp. Yeah. Thank you.
Thank you so much, Gifty.
Thank you, Ms.
And
Charlotte,
I just want
for the
to
opportunity.
acknowledge Moji Rola, Nabukira, Doreen, Philip Andrew, Mwebeza, who've been reposting. Let's see what it looks like on LinkedIn. So here we're going back to the initial announcement of the global survey. And here we now have 26 likes, 11 comments, and 9 reposts. The reposts are actually the most important. So Mario, Charlotte, Zana Ali Haruna, Dr. Shanta Gatak, Usman Mohamed Tukur, Kaltimi Shuaibu, myself, Rebecca Bello, Mahesh Bhatt. Everyone can contribute in this way. Back to you, Charlotte.
Thank you, Reda. So right now I'm turning towards Umapela Abdurrahman. Umapela, are you able to unmute? Your hand was raised.
Yeah, good afternoon.
Good afternoon. And please do introduce yourself.
Yeah, my name is Umar Pela Abdurrahman from Adamawa State, Nigeria. I think this is my first time this year to join I mean, late last year because I couldn't able to join due to some conflicting priorities. So I'm happy to join you this afternoon. Actually, I have been conducting the survey. I even do the survey. I send my comments, but I was unable to join at the session. Actually, climate change is everybody's concern. And I believe that everybody need to put their hands on deck to be able to make contribution towards this global climate change. I would like to say here that actually at the moment I am not under an organization. I'm working on a personal note, or having worked with an organization for the past 15 years. I know what it means by the climate change aspect as it contributes to the health. Climate change, in this aspect, I'll be inviting some both former and present colleagues that we have been working with at the WHO and the agricultural colleagues. We have some So intersectoral collaboration with them ever since. So I think I also invite my friends in conducting this survey.
So Umar, I have a question for you. How many people do you think you can get to take this survey in the next 4 weeks? Right now, this is February 5th. So how many of your colleagues?
I can get, as an individual, I think I can get up to 10 to 15. Okay. Because right now, as I'm talking to you, I have about 3 colleagues that are listening to our discussions right now, and they are willing to participate.
Okay, we send them warm greetings. I'll tell you the reason I ask is because if you recall, so as an individual, we ask you to tell us who you shared with. So in the same email, the call to action, you'll see point number 3 is tell us who you shared with. So that we can recognize your support. And we've given you a Friday deadline. Usually we extend that until Sunday if you need more time. We know some of you only have time for this type of activity on the weekends. But what does that actually look like? Well, if you click on that link in the email, you get to tell us how you are helping reach your colleagues. And this is because we want your dissemination efforts, Umar, and everyone else to count. And so we ask you to complete this quick questionnaire so that we can recognize and honor your contribution. So of course, we want to tell us which program you're helping to disseminate, climate change and health. And then we ask you this question: how many people do you think this will reach? And this is where you can tell. So for example, for Umar, he would put 15, but then we ask you exactly, are these colleagues from your organization, a professional network? So let's say it's colleagues from my organization. You can click, I think you can choose as many as you like here. Who are you reaching this way? So, you can say, well, yes, community health workers, if that's the case. You can tell us a little bit more. And then you can tell us if you have, for example, you posted something on Facebook and you want to tell us about it, well, then you can go and get the link, just copy the link where that shows up and actually share that with us. Or you can skip that. Then we ask for your email. And that is how we then recognize and are able to know that you actually have contributed to dissemination. If you don't tell us who you shared with, you may have shared with thousands of people, but we won't be able to know. And so for individuals, it's really to recognize and honor you. But for organizational partners, we ask it. You can see that the final step for selecting partners for the survey is that proof of dissemination. So it's really 2 things. One is to become an organizational partner, to complete the application. And then the second step 2 is actually to fill out what we call the dissemination register. So once your organization has shared, or once you have shared as an individual, use the link that is found in the email. It is a personalized link, so you can't just share it with someone else, but that is the process that we have in place. So back to you, Charlotte. I think we're almost, we're going to keep going maybe for another 3 minutes to hear. I see there are many hands raised, so we appreciate the enthusiasm and the energy. As you know, at the Geneva Learning Foundation, we've been working on these climate and health issues since July 2023, really learning with you, learning from your observations, from your experiences, and then connecting with Grand Challenges Canada and many other global partners. So we're so pleased to see the level of enthusiasm and commitment in the room. Back to you, Charlotte.
Thank you, Reda. Many hands raised and also many comments in the chat. So Paul Oche, your mic is unmuted. Over to you.
Okay, good afternoon, everyone. I'm Paul Oche. I work for Malaria Consortium here in Nigeria, and I'm currently working on the Global Fund project on malaria programs here in Niger State. So I have had series of opportunities to contribute and teach to learn, and I've been able to participate in so many of your surveys. I think I will be sharing this climate health issues with my professional colleagues and my coursemate. I'm currently doing my second master's on health economics and management and policy from the Global Health and Infectious Diseases Institute. So I'll be sharing with some of my colleagues to participate in the survey, and I'll equally be disseminating to my WhatsApp platform, global platform, particularly those who are in energy and gas those who are into green energy and all of that, so that they can also give their perspective in the survey. So thank you very much, and over from me.
Thank you so much, Paul Oche. Right now, I'd like to turn towards Ibrahim Lawan.
Okay, thank you very much, and good afternoon, everyone. My name is Ibrahim Lawan. I'm from Nigeria. I'm a member of the Nigerian Red Cross Society. I'm the Assistant Health and Care Officer from Plateau State Branch, and I really appreciate this survey. And actually, I will share it with my department, that is the Health Department, particularly my boss, the Health Officer, and the branch secretaries. In category, I will make sure that I reach the partners. Hello, can you hear me?
Yes, loud and clear.
Thank you. So with the Nigerian Red Cross Society, I will try my best to share with our staffs, our members, then we have volunteers. Then on a personal note, I have a professional colleague because I'm an environmental health officer. I will also share it with my professional colleague because climate change is a serious matter and it's a background in the Department of Environmental Health. So thank you very much. I'm over and out.
Thank you, Ibrahim Lawan. And last but not the least, I will listen to today is Kingsley Kofi Ninyere. Kingsley, over to you. Kingsley, I'm asking you to unmute if you can still hear us.
Hello. Yeah, thank you very much for the opportunity. I'm Kingsley Kofi Ninyere. I work for Community Youth Development Foundation, a non-governmental organization based in Ghana. Yeah, for today, I'm connecting from Accra. I'm in Accra today for a program. Yes, I will share the survey links with my colleagues, and I've already done that. And these are the people that I will do. Why? Because to help mitigate and develop strategies to climate change effects, I will share with Ghana Coalition of NGOs in Health, which has already done that, which is made up of 150 members. And I've also shared with Ghana Coalition of NGOs in Climate Change. I've also shared with them, which is also made up of 100 members. And then I will also share with the planning officer in my municipality, as well as the MOFO director, because this department, the assembly, which is a municipal assembly, and that of the MOFA, they are also who have been helping in one way or the other to mitigate climate change effect in the municipality. So I wouldn't hesitate to share with them to help mitigate and develop climate change strategies to mitigate the change. Thank you very much. I'm over.
Thank you so much, Kingsley Kofi Ninyere, and whether that was the last hand that was raised. And I also want to recognize all those who shared comments in the chat. And I said it's a good thing to share with our colleagues, our professional networks, but it's even better for us to follow up with them and ensure that they complete and submit the survey. Thanks, Reda. Over.
Thank you very much indeed, Charlotte. So thank you. We wanted to keep it. We wanted to keep it to under an hour, so we're at the 47th minute. We're now going to do the same thing with Charlotte with the francophones, of course. For those of you who want to just to recap, this is part of Teach to Reach 11. We're actually going into Teach to Reach 12. We'll be announcing the date and the focus very soon. If you have poor connectivity, you can get the podcast on www.learning.foundation, and it's like listening to the radio, so in some cases you won't be able to see certain information on the slides. We're very pleased to be working with Grand Challenges Canada and so many other partners on this global climate change and health survey. Look for the call to action every step. There are 3 steps. Make sure that you complete, that you read each one carefully, and that you complete each one, especially if you are interested in becoming an organizational partner. The selection criteria include this proof of dissemination. So using the last link at point 3, tell us who you shared with on behalf of your organization so that we can properly recognize that. That's it for today. Once again, thank you. And we can't wait to see you again for Teach to Reach 12. Thank you and goodbye.